What makes some bladders more sensitive to certain irritants? Imagine your bladder as a finely tuned instrument. Sometimes, it becomes overly sensitive, reacting strongly to things that normally wouldn't cause trouble. This heightened sensitivity is often due to a mix of factors like inflammation, nerve changes, and the health of the bladder lining. When the bladder encounters irritants such as infections, chemicals, or allergens, it can trigger an immune response. This response releases substances like cytokines and histamine that cause swelling and attract immune cells to the bladder wall. Over time, if this inflammation persists, it can damage tissues and cause fibrosis, making the bladder more reactive and painful. Histamine plays a key role here. It's released by mast cells during allergic reactions or inflammation and can directly sensitize the nerves in the bladder. This means the nerves become more responsive to stretching or filling, even at lower volumes. As a result, you might feel urgency or pain sooner than usual. The lining of the bladder, called the urothelium, normally acts as a barrier to keep irritants out of the deeper tissues. But when it's damaged or inflamed, its permeability increases. This allows irritants in urine to reach nerve endings and trigger discomfort or urgency. Changes in nerve receptors and channels also contribute. Proteins like TRPV1 and TRPA1, along with certain receptors for ATP and other molecules, become more active or are upregulated. This makes nerves more excitable, amplifying sensations of urgency, pain, or frequency. Genetics can influence how sensitive your bladder is too. Some people are naturally more prone to inflammation or nerve hypersensitivity due to inherited traits. Environmental factors such as stress, smoking, or consuming bladder irritants like caffeine, alcohol, or artificial sweeteners can worsen sensitivity. Understanding these mechanisms highlights the importance of avoiding known irritants. Limiting caffeine, alcohol, and tobacco can help reduce inflammation and nerve hypersensitivity. Managing chronic inflammation with medical guidance may restore some balance to the bladder lining and nerves. Staying well hydrated and maintaining a healthy lifestyle also support bladder health. If you experience persistent symptoms, consulting a healthcare professional is essential. They can help determine whether your bladder sensitivity is part of a benign condition or something that needs further investigation. In essence, some bladders are more sensitive because of a complex interplay of inflammation, nerve changes, and lining health. Recognizing these factors allows us to take steps to protect our bladder health and possibly lower the risk of more serious issues in the future. Always remember, individual experiences vary, so personalized medical advice is key to managing bladder health effectively.